Well, a group of nursing graduates who have been working without pay for nearly a year have been assured by the Minister of Health that their matter is being resolved. Keishla Adderley reports tonight that the nurses approached the health minister nearly a month ago.
45 nurses are looking forward to resolution after reportedly going for months on the job without being paid. We're told that the clinical and registered nurses were among the number who have been forced to survive on a $475 a month stipend since completing training last fall. Health Minister, the Honorable Dr. Dwayne Sands, called their story heart-wrenching.
They had an expectation that they would be paid. They were hired, they were deployed. Unfortunately, the civil service knew nothing about them, and the Ministry of Health had not done the requisite paperwork to ensure that they would be paid. I want you to understand the humiliation that these young women would have faced.
From humiliation to relief, Maria Butler and her colleagues are thankful.
Being paid from last year, November, was very hard. We've had a number of times where we are told to lean on family, go to friends, and at some point we would take that advice, but then persons see us getting ready to go to work every day, and then they start to wonder, why are you going to work if you're not being paid?
Dr. Sands says combined $1 million in payments will begin in a few days. The group will likely receive about a third of the money owed to start off with.
What we have done is to make arrangements for them to receive their arrears in portions, but to get them regularized to receive their salary. And it is my expectation that that should be happening within a few days.
Dr. Sands notes that in the absence of those salary payments, large contracts were being paid out.
There were hundreds, if not thousands, of people that were not only employed, but were receiving huge contracts, some for hundreds of thousands, some for millions of dollars. The records would reflect that there was at least one vendor who on one day would have gotten an amount that could have paid off every single one of these nurses, everything that they were owed from the time that they started working. And yet, they were forced to suffer.
Dr. Sands says correcting the problem was for the government personal, as he and Prime Minister, the Honorable Dr. Hubert Minnis, know firsthand the value of nurses to the healthcare system. Keishla Adderley, ZNS Network News.